In this video, we will go over a nursing case study. Since the new generation Nclex will implement a 6-layer clinical judgment model to prepare students for real-world medical scenarios, this case study is a great practice tool. All answers will be at the end of the video, so be sure to write them down as you go. Now let's begin. Mrs. Ann Rivera, a 32-year-old G3P2 at 30 weeks of gestation, presents to the emergency department with painless vaginal bleeding. She reports no contractions but says the bleeding started suddenly while resting at home. She denies trauma or recent intercourse. Her prenatal records show no complications until now. On admission, her vital signs are stable, and the fetal heart rate is 145 beats per minute. A transabdominal ultrasound confirms a diagnosis of complete placenta previa. She is admitted for monitoring and possible intervention. Here is her background information. Gestational age 30 weeks, Gravida 3, Para 2, current medications, prenatal vitamins, ferrous sulfate, history, no prior cesarean deliveries or uterine surgeries. Question 1. What is the primary concern in placenta previa? A. Fetal infection, B. Uterine rupture, C. Maternal and fetal hemorrhage, or D. Preterm labor. Question 2. Which nursing interventions are appropriate for Mrs. Rivera? Select all that apply. A. Perform frequent vaginal exams to assess cervical changes. B. Monitor fetal heart rate and uterine activity continuously. C. Educate the patient to avoid sexual intercourse. D. Administer Rho-D immune globulin if the patient is rate negative. E. Prepare for possible cesarean delivery. Question 3. Placenta previa is diagnosed when the placenta is located blank the cervical oas. Question 4. During monitoring, the fetal heart rate drops to 90 beats per minute for 60 seconds and then recovers. What is the nurse's priority action? A. Document the finding and continue monitoring. B. Notify the healthcare provider immediately. C. Increase IV fluids and reposition the patient. D. Prepare the patient for emergency cesarean delivery. Question 5. Match the following risk factors with placenta previa. A. Prior cesarean delivery. B. Multiple gestation. C. Smoking during pregnancy. D. Advanced maternal age. Question 6. Mrs. Rivera begins to bleed heavily, and her blood pressure drops to 88/54 millimeters of mercury. What is the nurse's first action? A. Call for a rapid response team. B. Increase the IV infusion rate. C. Check fetal heart rate monitoring. D. Prepare for emergency delivery. Question 7. True or false? Immediate delivery is always required for patients with placenta previa. Question 8. Identify the placenta location on an ultrasound that confirms placenta previa. Question 9. Medication management. Which medication might be administered to Mrs. Rivera to promote fetal lung maturity if preterm delivery becomes necessary? A. Oxytocin, B. Betamethasone, C. Magnesium sulfate, D. Misoprostol. Question 10. What activity restrictions should the nurse include in discharge teaching for Mrs. Rivera? A. Complete bed rest until delivery. B. Avoid sexual intercourse and strenuous activity. C. Walk for 30 minutes daily to maintain circulation. D. Continue regular activities as tolerated. Let's see how you did. Let's now go over the answers. Question 1. The answer is C. Maternal and fetal hemorrhage. Placenta previa occurs when the placenta partially or completely covers the cervical os, increasing the risk of bleeding during pregnancy or delivery. Question 2. The answers are B, C, D, E. Vaginal exams are contraindicated in placenta previa due to the risk of provoking bleeding. Continuous monitoring, patient education, administration of Rho-D, immune globulin if indicated, and cesarean delivery preparation are essential interventions. Question 3. The answer is over or covering. Placenta previa involves partial or complete coverage of the cervical opening, leading to complications like bleeding and preterm birth. Question 4. The answer is C. Increase IV fluids and reposition the patient. Increasing fluids and changing maternal position can improve uteroplacental perfusion. If the fetal heart rate does not stabilize, further interventions may be required. Question 5. The answer is that they are all correct. Risk factors for placenta previa include prior cesarean deliveries, multiple gestation, smoking, and advanced maternal age. Question 6. The answer is B. Increase the IV infusion rate. Restoring maternal hemodynamic stability is the priority. Other actions follow depending on the patient's and fetal status. Question 7. The answer is false. Delivery timing depends on gestational age, bleeding severity, and fetal well-being. Conservative management may be appropriate if the mother and baby are stable. Question 8. The answer is the diagnosis is confirmed when the placenta partially or completely covers the cervical opening. Question 9. The answer is B, betamethasone. Betamethasone is a corticosteroid that accelerates fetal lung development, reducing the risk of respiratory complications in preterm infants. Question 10. The answer is B, avoid sexual intercourse and strenuous activity. Avoiding activities that may provoke bleeding is essential for patients with placenta previa. Alright, well, that ends this video. If you found this video useful, leave a like, a comment, and subscribe so we can make more videos like this.